Hello, my name is Emily Steffan, and I'm a senior health sciences major at Carroll College. With the guidance of Gerald Schaefer, I decided to carry out a systematic review on deep venous thromboses, abbreviated DVT. A DVT is a formed blood clot or thrombosis in a deep vein. To gather more literature for this review, the search term venous thromboembolism, abbreviated VTE, was used as well. VTE is a term that encompasses both DVT and pulmonary emboli. Treating VTEs in the United States costs $10 billion annually. Additionally, 900,000 people are affected by a DVT or PE each year. This number is believed to be an underestimate, however, as many cases of DVT go undiagnosed each year. There are two primary tests for predicting the presence of a DVT: a D-dimer and Doppler ultrasonography. A blood test called D-dimer is a safe and effective way to rule out DVT, but cannot diagnose a DVT on its own. Ultrasonography is non-invasive and can diagnose a DVT, but is expensive and requires technical expertise. The purpose of the study was to review the literature on the use of D-dimer and ultrasonography to diagnose DVT and determine which one is the preferred test when considering all risk categories. Risk factors, along with clinical presentation, can help clinicians place their patients in the appropriate risk category, as the clinical presentation of DVT is not specific to the condition. Symptoms similar to DVT may occur in other conditions, such as cellulitis, a ruptured Baker cyst, superficial thrombophlebitis, and other musculoskeletal conditions. Research has shown that D-dimer can be used to rule out DVT in patients with low clinical risk, but in patients with elevated DVT risk, a positive D-dimer alone may not be enough, as the test lacks specificity. Primary resources for this systematic review were gathered in January and February of 2021 from the search engine PubMed. Additional resources were gathered through Google Scholar, yielding a total of 10 resources eligible for review. Sources included 2 clinical trials, 2 comparative studies, 1 case control study, 1 case report, 2 expert opinions, and population data. The overall consensus throughout most of the studies is that a negative D-dimer can rule out the presence of a DVT in all patients, but a positive D-dimer, even in combination with clinical judgment, cannot diagnose a DVT. Some studies had conflicting results. Hirsch and Lee and Ilkan-Habor et al. Found that combining clinical assessment with both ultrasonography and D-dimer is the best way to definitively rule out a DVT, while Wells et al. Developed criteria that allow specific clinical judgments in combination with a negative D-dimer to rule out DVT. Wells et al. Found that these 2 strategies used in tandem are enough to forego ultrasonography. Meow et al. Found that in patients with a high clinical risk of DVT, ultrasonography is preferred, while in those with a low or moderate risk, a negative D-dimer is enough to exclude a diagnosis of DVT. Goslin et al. Concluded that D-dimer test on its own is not as sensitive and specific as combining it with other biomarker tests. However, despite the general consensus in the research literature on this topic, clear clinical guidelines have yet to be widely disseminated and put into practice. This review concludes that practice for diagnosing VTEs should become standardized across the United States. Over half of VTE cases are idiopathic, meaning that the causes are unknown. Further research is necessary to determine these unknown risk factors for DVT, so clinicians are aware of more situations where their patients may be at risk for a DVT. Recently, Colliet et al. Found that patients who are hospitalized for COVID-19 are at a higher risk of developing a DVT. Further research must be done on how SARS-CoV-2 affects those with DVT, so physicians are equipped to treat their patients. Consistency in DVT diagnosis will benefit patients and clinicians by eliminating unnecessary testing and by reducing the number of overlooked DVTs. In conclusion, this review determined that a negative D-dimer test can rule out a DVT, but a positive result is not sufficient on its own to diagnose a DVT. Ultrasonography is recommended in conjunction with D-dimer testing to definitively rule out a DVT, But when a D-dimer assay is negative in patients with low to moderate clinical risk, ultrasonography can be omitted. Thank you for watching my presentation on ultrasonography and D-dimer in diagnosing deep vein thromboses. Any questions can be asked via email to esteffan@carroll.edu. Thank you.